Yes, good job. Oh, on a runny nose.
Alright, so, you're Grant.
Yes.
And you're how old?
15.
15 years old, and you were injured by vaccines.
Yes.
Do you want to tell a story? You want your mum to? You want to do it together?
Mom.
We do it
Mom?
together, yeah.
Oh boy. How about together?
Fine.
So, developing normal pregnancy, nothing to worry about. At about 9 months, we started noticing that when he was cruising furniture, that he would drag his one foot and not use it quite as well as the other foot. So he would always start steps or start climbing up things with his left foot instead of his right. Shadow, sit. Sit. Yeah, I know. You want to come in, though. So, we followed up with the pediatrician, and the pediatrician is asking us all these questions. How much does he use his one hand versus his other hand, his one foot versus his other foot, and typically kids don't develop a hand preference until they're 3 years old, and Grant was using his left hand 90% of the time, and as opposed to his right hand, in doing two-handed activities. So that was our first clue that something wasn't quite right.
And he was fully vaccinated up to this point.
He was fully vaccinated up until then. He surprisingly, when I went back and looked at all of the records before this, we found out that he did not receive a Hep B at the hospital, but he didn't receive his first one until he was 6 months old.
So he was
surprising.
For 6 months.
Well, he should have received the Hep B at the hospital, but he didn't. So he still got his 2, 4, and 6 month vaccines. And usually there was either 1 or 2 vaccines at that time for him. It wasn't, this 4 or 5 at a time. I know. Can we ignore the fly? So at 9 months we were sent for an MRI. MRI came back essentially normal. There was a small area on the left parietal lobe that showed a small part of...
No, get it.
Polly, this is going to hurt.
I don't care. Get rid of the fly.
Ow!
Jeez Louise, that was painful.
Oh no!
And you know what? It took off right before I hit you.
I'm not even
I
get
didn't even get it.
Wow, that woke me up. Sorry about that.
Sorts of craziness going on.
Let me just plug that back in. That was a little painful.
And it sounded loud,
If it got it, it would have been worth
Oh my
it.
gosh. No. Anyway, so
Yeah. Off we go again.
at a year old, he was diagnosed with left parietal stroke. So it affected sensory and some emotional stuff. It kind of explained the motor delay, but it was pretty obvious for him that there was a motor issue, a motor component. So he started PT, and he was really close to walking at that point, so he only had about 6 weeks worth of PT before he was walking independently. So by this age, he was 18 months. Around that same time, around 20 months, I think, he started having these night wakings where he would, about 90 minutes after we put him to bed, he would wake up screaming, and he wouldn't be able to answer us. And we were told that it was night terrors for another 18 months. So about 3, we finally went to a different neurologist who did the EEG and diagnosed him with frontal nocturnal seizures. So they only happen at night, they only happen as he's falling asleep, and there really isn't anything to do about them. So at that time, we also earned, since we were going to Mayo Clinic, we also earned a full week of workup there, and that's where they diagnosed him with an unknown myopathy. So now, by the age of 4, he had a stroke, seizures, and a myopathy. Along with Lanae's story, who was happening at the same time, where she was already having delays.
So both of you are in wheelchairs?
And both kids used power chairs for distances. Yep. Grant's had his for 6 years. Lanae's had hers for 4, almost 5.
How does it affect your life?
Of what, the wheelchair?
Yeah, just the whole
Or just the whole
vaccine
delays
injury.
and myopathy in the whole big picture.
I mean, it's a little bit more challenging because I can't do because I can't normally do what my peers would say be able to do.
Do you think people treat you differently?
Yes, a little bit.
A little bit, yeah.
So it's tough. Tough
Mhm.
at school.
School's not so much a factor since I attend an online virtual school.
And that's one of the things is we can distance ourselves from bullying and in-person judgments because, you know, everybody's basically behind a screen at the online school. Nobody really knows until you meet in person who has what challenges.
Mm-hmm.
Yeah. Because they don't really see each other in person or even online. They just have a name and a personality online. Yep. So after the seizure diagnosis came the PDD and Asperger's diagnosis. And basically Grant's been stable since then. He hasn't really added new diagnoses. He did end up with BiPAP because he had some daytime fatigue that started with puberty. So he is also on BiPAP for now 4 years almost.
Something like that.
What if
Yeah.
if we could put right what's so bad is gone? What would you want? What would you like to see happen from your injury? What would you like to see happen positively from what's happened to you?
So
I'm
if,
not saying that very well. You
if
explain
telling your story helped somebody, how would that help somebody? How would you want somebody to not? Would you want somebody to not have a vaccine?
Will you stop using me?
It was
Did you even
landing
get
right
it
there.
then?
No, you took off.
Right,
again.
you hit me one more time and don't get that
I know.
bloody fly. You're
Sorry,
in
I
trouble.
didn't. You know what? I'm not hitting it hard enough. That's the problem. Sorry.
That's okay.
Oh, the entertainment value, huh?
Mhm.
So what do you think?
So just if hopefully other people won't have to go through the same experience and the people who make the vaccines will sooner or later wake up or something like that. They'll just listen instead of ignore it.
Because what's going to happen if nothing changes?
It's gonna half the people in the country are gonna have autism.
Yep, half the kids. Yep. And it's already, you know, Grant and Lene both were affected by the CDC study that is the subject of Vaxxed. And so his and her injuries could have been avoided if we'd known the truth. Because, you know, he didn't have a diagnosis before that 9 months. And, you know, whatever vaccine it was at the time or combination started the downhill slide. He has a lot of similar diagnoses to Lene, mito dysfunction complex 1, and the BiPAP and the weakness and the muscle fatigue, and all of those could have been avoided if we had known the true risk factor of the vaccines versus the diseases. You know, after 10 years of not having vaccines, they still have not had chickenpox, measles, the flu. Lene's had whooping cough.
She has?
I think that's why she ended up dehydrated the first time we went inpatient.
Oh yes, that time.
And she crashed really hard. Her blood sugars crashed and we ended up inpatient for fluids before we had the home IV service that she talked about. So, I mean, their injuries could have been avoided. And instead, we have $80,000 worth of power chairs, because each chair is about $40,000 because of all the features that they have. You know, Grant qualifies for a waiver because of his delays and his social challenges that he has in Minnesota. So, you know, it's expensive. You know, and that's not even counting things like the gluten-free diet and the supplements and things, the mito treatments that we've tried, and the travel expenses that aren't covered by insurance.
Sign them
We're
off.
gone. On the other
Where are you
side?
going to be?
Yep.
All right, he already picked out a spot.
Is it Danny?
So did you make no river? Yes, we did.
Oh, I want a picture with you, Polly.
Okay, we've got Grant sign the back and let's do it. 1 second. What's
how's it
happening
going?
with the vigil thing?
What number? I haven't been.
I think it's 4359. That's a dog.
So he's left-handed because of the stroke?